right, so hello everybody, my name is Dr. Eric Owashi. Like Joseph said, one of the newest members of AVORS, and today I'm going to be talking about knee arthritis and total knee replacement. But quickly, just a little background about myself since I haven't met a lot of you yet. I was born and raised in a small city called Walnut, California. This is Southern California by Diamond Bar, West Covina, Pomona area. I went to undergrad at UC San Diego where I double majored in biology and psychology. I got my medical degree at Wayne State in Detroit. That was followed by an orthopedic surgery residency at New York Medical College in Valhalla, New York. And finally, I ended back up at Scripps in San Diego in Southern California where I performed and completed my fellowship in adult hip and knee reconstruction, primarily for arthritis. So today I kind of wanted to go over what arthritis is and the treatments for arthritis, including total knee replacement. So arthritis, by definition, is damage to the articular cartilage on the ends of our bones within our joints. In particular, I'm going to be talking about the knee. There are different types of arthritis, such as rheumatoid arthritis, where there's autoimmune cells that your own body creates to attack the articular cartilage within your joints. There's also post-traumatic arthritis, where you have a traumatic injury to your cartilage, or like a meniscus tear, and that leads to the progression of arthritis. Or you can have regular, and most commonly, osteoarthritis, which is your normal wear and tear disease of the cartilage within your joints, including your knee, that occurs over time just by doing your daily routine, like walking and doing your normal activities. So, the problem with arthritis, and most of you already know, is that there isn't a medication out there to cure cartilage damage. So unfortunately, when patients start having pain from their arthritis, that pain is permanent, okay? And as you continue to walk, you continue to scuff up more and more of that cartilage. So unfortunately, since there isn't a medication to halt the process, it gets worse and worse over time. So the pain that people have becomes permanent. As you continue to walk on it, it continues to get worse and worse. So the natural progression is people start off having pain out of nowhere when they're walking every now and then. Then they begin having pain at the end of each of their walks. Then they have pain or stiffness when they get up from a chair. Eventually, it hurts with every step you take. Eventually, it hurts even when you're sitting down, not putting weight on it. Patients typically start off with a cane, then move to a walker. If you don't do anything about it, you end up in a wheelchair, unfortunately. So the next question is, what do you do about it? Oftentimes, the first line treatment, you treat your pain. And the way that patients do this is by changing the way you behave. You just don't do as many things that you want to do, and you modify your behavior to avoid the pain. People start taking pain medication like anti-inflammatories like Aleve, ibuprofen, Motrin, Celebrex, Meloxicam. But eventually these pills don't work, and you still need to do your normal daily routine. And our goal for your treatment is to keep you functional, keep you able to do everything that you want and need to do without crazy knee pain. So tools that we have to do this include cortisone injections. These are intra-articular steroid injections we put inside the knee that kills all the inflammation created from the osteoarthritis, results in a pain-free knee. If the pain subsides for a total of 3 months at a time, it can be repeated, and often they're repeated multiple times to try to delay the need for your surgery. Once these cortisone injections stop working, the next step is possibly doing viscosupplementation or hyaluronic acid injections. Those are a series of injections where you put a thicker lubricating jelly inside of the knee to replace the function of the cartilage. Because remember, the cartilage is supposed to act as a lubricant. And these can be repeated if they give you significant benefit for 6 months. But unfortunately, even though we take the pain away, these injections do not cure the cartilage. So you continue to walk on it, you continue to have pain, your arthritis gets worse. And as your arthritis gets worse, the duration of effect of each of these injections, unfortunately, gets smaller and smaller. If they don't work well enough, then we move to our only long-term solution for debilitating knee arthritis, which is total knee replacement. Now, total knee replacement is a great surgery, because what we're doing, everyone thinks initially, when you first get told, I need a total knee replacement, everyone thinks you're just going to chop off the whole bone and put a big old chunk of metal in there and you're fixed, right? And that's not what happens, all right? You keep the majority of your own anatomy. You keep more of your own anatomy than you think. All we really do is we shave off the surface of the femur, the surface of the tibia, the bottom surface of the kneecap, the patella. You get a metal cap on the end of the femur, a metal cap on top of the tibia, a piece of plastic in between the two to act as your cartilage. Also, you get a piece of plastic underneath the kneecap that slides up and down the metal component of your femur. And this is a great procedure. It takes about an hour, hour and a half, and Ted is very fast. He does it in like 40 minutes. And then you're up and walking on that knee with your full weight the same day of surgery. Most patients use a walker initially for maybe 2 to 3 weeks at most. After about 1 month, patients are walking normally, which means no cane, no walker, no strong pain medication. After about 3 months is where I let my patients go out to the wild and do everything that they want to do. Now the difficult thing recovering from a total knee replacement is that, as everyone here is aware, you have to regain your full range of motion following the surgery. And it's a painful surgery, unfortunately, which means you have to really stretch out that tissue as hard as you can to have a good result. But if you're able to do that, the vast majority of patients are very pleased with the outcome of the surgery, because total knee replacement surgery is one of the most commonly performed surgeries in the United States. And the vast majority of them are completely happy and satisfied with the surgery. Over 80 to 85% of patients that get the surgery done are able to walk afterwards without any significant knee pain. All right, and the vast majority of the patients that are unhappy are the ones that unfortunately didn't do the therapy hard enough initially. They ended up with a stiff knee, and because of that, they can have some functional disability afterwards. So the main thing is that everyone's already been aware, you really got to stretch that knee after surgery. Okay? So the great thing about technology is it's always advancing, including for the total knee replacement surgery. And here at AVORS, we're proud to announce that we're trying to bring a robot to one of the local facilities, local hospitals in the area. So we're going to start performing robotic total knee replacements. I personally have already been trained in my fellowship and residency in robotic knees, and I think it could be a game changer by allowing the surgeon to make more precise cuts and planning exactly how to balance the knee before any surgery has been performed. So, just want to give you guys a heads up that we really appreciate that you guys look for us for your care, for your joints, and your knee and hip replacements. I want to give you a heads up that hopefully robotic knee replacement will come into the Antelope Valley very soon. All right, thank you.